Good morning, everyone. My name is Avi Bucksbaum, and I'm currently completing eighth grade at Lawn Charter Middle School, and I will be attending Nueva High School in the fall. It is my pleasure to introduce Yashashwi Bista, an undergraduate student at Stanford University studying human biology. She is deeply passionate about health equity and dedicated to raising awareness about celiac disease. Today, she'll be presenting on the social, financial, and psychological considerations associated with celiac disease, highlighting the broader challenges faced by individuals living with this condition. Please join me in welcoming Yashashwi.
Hi, everyone. My name is Yashaswi Bista. As Avi mentioned, I am an undergraduate student at Stanford in my third year, and I started working with Dr. Jericho last summer on the celiac school study, and I've just been continuing to work on different projects such as this one. And this is one of the projects that I'm really passionate about. It is the Food is Medicine Gluten-Free Access Initiative. So first, I would like to say some background information about the study and why we decided to start doing it. So, as we all know, celiac disease is an autoimmune disorder triggered by gluten and causes intestinal damage, malabsorption, and possible symptoms within and outside the GI tract. Extraintestinal symptoms include depression, anxiety, and osteoporosis. And strict adherence to a gluten-free diet is the only treatment for celiac disease and should restore intestinal health. Yet, it is not covered by insurance despite functioning as an essential therapy, which I think is very, very wrong, and we should advocate for this. So first, I want to ask everyone a question. I put a bunch of different numbers here to make it really difficult. So how much more expensive do you think gluten-free diet is compared to regular food? So number one, 556%, number two, 242%, number three, 58%, and number four, 189%. I see a lot of twos, fours. Everyone's going to be really surprised. So it's actually 242% more. It's very expensive. And as we can see from this diagram, you can look at bread, cereal, pasta, crackers, pretzels, cookies, waffles, pizza, mac and cheese, and even cake. It's all more expensive to contain gluten than regular foods. Next, in our literature review, we also looked at the differences in costs by region: New York, Chicago, Atlanta, Rapid City, Portland. And even online, gluten-free food is always more expensive than regular foods containing gluten. So why does this matter? Well, I'm sure that this is something that matters for everyone here who has someone in their life who has celiac disease or has celiac disease themselves. This matters a lot because of the expensiveness. But also, for a lot of people, they experience food insecurity. In fact, food insecure patients with celiac disease were disproportionately younger, poorly educated, non-white, and living in poverty. This means that with lower socioeconomic status, there is more food insecurity. In fact, 16% of patients with celiac disease in the United States are food insecure, and those affected by food insecurity were significantly less likely to adopt a gluten-free diet, 24% versus 67% that were not food insecure. This can cause ongoing intestinal damage and increase the risk of serious long-term complications, which include iron deficiency anemia, poor weight gain, and short stature, osteoporosis, difficulties with pregnancy, increased risk of additional autoimmune diseases, and heightened risk of intestinal lymphoma. So we know about all of these consequences. They're all in the literature about how celiac disease causes all these extraintestinal symptoms and worsens gut health. But what do we do about it? Well, this is what our center is focused on. So this project is called the Food is Medicine Gluten-Free Access Initiative, and it aims to evaluate this financial burden and psychosocial effects associated with initiating and maintaining a gluten-free diet among individuals with celiac disease. So we have two objectives. One objective is a scoping review of the current literature examining adherence to a gluten-free diet, as well as its associations with food insecurity, stress, and financial burden. Our second objective is advocating for reforms to current policies surrounding the gluten-free diet, because it should be covered by insurance. So I want to ask a question to everyone. Does anyone know what a scoping review is? So you may have heard of literature reviews. Literature reviews are when you go into the literature, like published studies, and you look through them and you find information about anything and you have a literature review. A scoping review is similar, but it focuses more on the research gap and finding broad key findings. So our project is focused on going into the literature and looking at the broad findings, and also focused on the research gap, which is the psychosocial and financial burden in celiac disease patients. So some of our literature review has already shown how unfair it is for us in the United States compared to other countries in terms of celiac disease and like a lot of healthcare. It varies among European countries. Italy provides a monthly coupon. Luxembourg provides reimbursement of 553 euros per year, and Belgium provides 38 euros per month. All these countries have some sort of way in the European Union to address celiac disease. However, unfortunately, in the United States, we have no health insurance coverage, and there are other options, though. The other options include tax deductions. So in your taxes, you can file the charges that you accumulated throughout the year buying gluten-free food. And then for those unhoused or facing poverty, there is options in food banks, gluten-free food. And SNAP and WIC are also organizations that provide gluten-free food, but it is very limited. So we looked at a different type of disease called cow's milk-free protein formula, which is covered by insurance. So cow's milk-free protein is a protein in milk that is reactive to casein or wheat in milk. So this is covered by insurance by the WIC, which covers specialty formulas, and you have to receive like a prescription and documentation from your doctor to be able to access it. However, I think this is a good example of something that we would like to see for celiac disease and gluten-free diet. We would like doctors to be able to write a prescription and provide documentation that patients need gluten-free food, and consequently, they will be able to receive food from like food banks like SNAP and WIC, and even go into grocery stores and buy their own foods from that is covered by health insurance. So I have another question. If insurance covered gluten-free foods, what outcome would most likely improve? 1, genetic risk of celiac disease. 2, availability of gluten. 3, food security and financial burden. And 4, diagnosis rates. Yeah, I think everyone is saying 3. Yes, this is what we would like to see. So this is part of our advocacy efforts with this gluten-free initiative. We would like to see some changes. Some changes include advocating for state-level expansions that allow WIC and SNAP benefits to better cover gluten-free diet, just as the cow's milk-free protein. We also want to promote policies that allow healthcare providers to prescribe or directly connect patients to WIC or SNAP benefits for diet-based treatment plans. And we want to encourage states to test innovative models like medically tailored medical packages through waivers and demonstration projects. Thank you. Together, we can create meaningful change for individuals living with celiac disease. And please reach out to our team to learn how you can support efforts to improve access to the gluten-free diet for all. Thank you.